Elle travaille à l'hôpital neurologique de Montréal. Elle est spécialisée dans les maladies neurodégénératives, mais son objectif principal est de travailler avec les patients externes de la clinique SLA. Elle travaille également à l'unité de hemodialysis de l'hôpital de Lachine. Avant que je cède la parole à Madura, j'aimerais que vous êtes conscient qu'il y a une icône qui s'appelle chat où vous pouvez clavarder vos commentaires ou vos questions. Les questions seraient répondues à la fin de la présentation. Avant que nous aurions quelques mots de notre collègue, Madame Diane Tekelec, sur notre trousse de nutrition que nous avons lancé semaine passée. Donc, hello all, and it is my pleasure to introduce to you Madura Arunasalampillai, a registered dietitian with a master's degree in nutrition. She works at the Montreal Neurological Hospital, specializing in neurodegenerative diseases. However, her main focus is working with outpatients in the ALS clinic. She also works at the hemodialysis unit at the Lachine Hospital. So it is my pleasure to introduce Madura. And if you'd like to share your screen with us, Madura, please go ahead now.
Okay, can everybody see the screen? Perfect. So hi, everyone, and thank you, Kate, for the introduction. So I guess I can start the presentation. So today I'm going to give everybody an update on how to optimize nutrition in ALS. So the first thing that we are going to do is, there we go. So the first thing that we are going to do is we're going to be looking at what I'm going to be talking about today. So our brief objectives for the day. So the first thing is we really want to look at what the importance of nutrition is in ALS. Why is it important and what can we do to optimize our nutrition as best as possible? Next, we're going to be looking at some of the barriers that might affect how much we are eating and why we might not be getting all the nutrients that we need. Afterwards, I'm going to go over some nutritional interventions and give you some tricks on how to optimize how much you are eating as much as possible. And then finally, we're going to go through what tube feeding is and why it might be indicated for you. So first, to understand why nutrition is so important, we have to understand the concept of energy balance. And what this concept is telling us is that there's a relation between how much calories we're burning and what that relation is. So what we can see here in the first diagram right over here is that when the amount of calories that you're eating is actually equal to the amount of calories that you're burning, then your weight will be stable. So you're not gaining any weight, you're not losing any weight, it's really going to be stable. In the diagram here at the bottom, we can see that if the amount of calories that you're eating is actually more than the amount of calories that you're burning, what you're going to see is that all this extra calories is going to be stored in your body and you're actually going to be gaining some weight. And then finally, in the bottom diagram right over here, what we see is that if the amount of calories that you're eating is actually less than the amount of calories that you're burning, you're going to be experiencing some weight loss. And unfortunately, the weight loss is what we typically see in patients that have ALS. It doesn't happen with everybody, but the vast majority of patients do have experienced this kind of weight loss. So why is weight loss not good for you? So weight loss happens when you do experience weight loss. You're not only losing muscle weight, but you're also losing fat weight as well. So you're having a loss of both muscle tissue and fat tissue. And what we see is that when you are experiencing significant weight loss, you're at risk of having malnutrition, and it's associated with having a shorter survival time. So usually what I typically like to do in order to assess your weight is look at your body mass index or your BMI. So typically with the BMI, we can see if your weight is okay for your age or for your height, and I can be able to better assess your weight. So what we see in research is that people that are overweight or who are moderate obese, and this is shown with BMI between 25 and 35, so it's a higher BMI, this is actually associated with a slower progression of ALS and a longer survival time. So this is why when my patients come in and they tell me that, they're a little bit overweight and they want to lose weight, I tell them that this is something we do not want to do. We really want to make sure that your weight is stable and you keep it in this nice range because it is associated with longer survival time. So it's important that if you are experiencing weight loss, to weigh yourself regularly. So if you are experiencing weight loss, try to keep a record of it and weigh yourself maybe once every week so that you can bring this record to your physician or to your dietitian and we can assess your weight loss. However, I know that sometimes for some people, it might be hard to have access to a scale or to even get onto a scale. So if this is the case for you, well then typically if you are being followed at an ALS clinic, which usually follow-ups happen every 3 months, you can get weighed at this point in time. So next, I'm going to talk about why the amount of calories that you're burning might be a little bit higher than what we typically see in our regular population. So one of the reasons why the amount of calories that you're burning or you're having such a higher metabolism is because you may be experiencing fasciculations. So fasciculations are basically little short muscle contractions. So it's kind of like twitching in your muscles. And all of this twitching causes you to burn a little bit more calories than normal. In addition to that, with ALS, because you have weakened muscles, it may be more harder for you to move, to do some physical activity, even to breathe can be very difficult. So all this extra effort you're putting into doing these tasks causes the amount of calories you're burning to go higher. So this is why the amount of energy that you're expending is going to be a little bit higher. Now let's talk about why the amount of calories that you're eating can actually be less than normal. So there's a couple of reasons why, and later on in the presentation, I'm going to be addressing some tricks to help you with each of these issues. So the first thing that I see in a lot of my patients is that they have dysphagia. And what this means is that they have trouble chewing and swallowing some food or liquids. And this usually happens because you can be experiencing a lot of weakness of muscle in the facial region. So you have weakness in your jaw, which causes you to use a lot of energy and makes it difficult to chew. You can have weakness in your lips, the tongue, in the reflexes involved with swallowing. All of these things can cause you to have trouble with chewing and swallowing. So because of that, you're not eating as much food that you want to be. Another issue that some of us have is that we have decreased respiratory function, meaning that it's much more difficult for you to breathe. And when it's difficult for you to breathe, you might be more tired during your meal times, you might be short of breath, so you're not able to eat all the calories that you need to. Another thing is that you might also have some difficulty to feed yourself or even to prepare meals. So this can really impact how much you're eating. Another common problem that we see is dehydration, and dehydration is something that we really do want to avoid because it can lead to other issues that will impact how much you eat. And I'll speak more about what those issues are later on. Also with ALS, you might be experiencing some changes in how much saliva you produce. And all the times we see that our ALS friends are producing more saliva than normal. And this can be very uncomfortable and difficult to manage all the saliva in your mouth. And because of this, you may not be eating as optimally as you should. Also, you can be experiencing some gastrointestinal intolerances, which basically means that if you have any issues within your digestive tract, so this can involve constipation, bloating, diarrhea, and for sure that if you're experiencing these things, you might be a little bit more hesitant to eat than normal. And then finally, Some of us can experience some anxiety or depression. So you can be very anxious about eating, or if you have depression, you might not really have the appetite or have really a good mood in order to eat. So that can really affect how much you're eating. And if this is the case, you want to make sure that you do speak to your physician, and maybe they can help you find another specialist that can help you with this, or they might be putting you on some medications. So next, I'm going to be going through what the nutritional interventions are for these issues. And it's important to note that with ALS, everybody with ALS experiences different symptoms and they have their own experiences. So one thing that can work with one person may not exactly work with another person, which is why it's important that you talk with your healthcare professional team, with the dietitian, and see what intervention will be best for you. So the first thing is, people always ask me, what kind of diet should I be following with ALS? So with ALS, well, we do want to make sure that you are still eating a well-balanced diet, and you're including foods from all of the different food groups. So that is very important. However, in order now to make sure that you're able, that because with the amount of calories that you burn is very high, we want to make sure that the amount of calories that you eat is going to be high enough to meet the amount of calories that you're burning. So in order to do that, we want to make sure that you're on a high calorie diet. And if you are following this kind of diet, it's going to help stabilize your weight and prevent any further weight loss. So this is the most important thing, because as I mentioned before, weight loss is typically not recommended after you're being diagnosed. So with the high calorie diet, you want to make sure that every single bite that you take counts. So trying to enrich all the foods that you're eating as much as possible with a little bit more fat or a little bit more sugar or carb to get as much energy as you need. And here I have some examples at the bottom here that kind of give some examples of this. So for example, when you're cooking, try to add some more butter, some more margarine to your foods, a lot of oil to get a little bit more fat and calories into the meal. Also, sometimes if you want to, after you've cooked your meal, you can even drizzle some olive oil over it just to enrich it a little bit more. Sometimes what I like to do is if I'm having an egg salad or a sandwich, I put a little bit more mayonnaise so that it really is enriched with more calories. If you're having soup, maybe instead of having a clear broth soup, which provides a little nutritional value, instead you can put some cream in it. So this is going to give you a little bit more calories with that. I also recommend to have some cream. It could be 10% cream, or even the heavy whipped cream that has 35% fat, and you can add that to the soup or to any of your cooking as well. If you're having, for example, milk and you're choosing 1 or 2%, maybe opt for the higher fat percentage, so 3.25% or whole milk. Also, if you're having a good way to kind of get a little bit extra calories is maybe having smoothies in between your meals. So have a smoothie with some whole milk. You can put some nut butters in it or peanut butter, something like that, and that when it's blended in, it becomes very smooth and creamy. Or you can even put some soft tofu in it as well. If you're having bread, you can add a nice thick layer of some jam or some jelly on it. Or if you're having pancakes, put a little bit more extra maple syrup. That's another way to enrich the calories and give you a little bit more sugar as well. And then finally, when you're having meals, add a lot of sauce to it. It could be a lot of gravy, some creamy sauces. And these are all some ways that you're going to be able to enrich your meals. And with the new ALS guidelines that came out recently, we see that perhaps a high carbohydrate diet, so a diet that's more higher in carbs, may be better to help with weight gain than a high fat diet. However, we still need to do a little bit more research to see why that is and to really confirm this. So in terms of protein, I just want to quickly point out that, as I mentioned before, we really do want to make sure that you are eating a well-balanced diet and that you are getting enough protein in your diet as well. So protein is the building blocks you need in order to make sure that your muscles stay preserved as much as possible. So with ALS, we know that we have progressive weakening of the muscles. So we want to make sure that with the muscles that you do have, you're able to preserve it as much as possible. And in order to do that, we want to make sure that you are getting adequate amount of protein in. So protein can come from two different food groups. So the first food group here is your meat and alternatives. So this means that protein is coming from your meats, your poultry, fish, any kind of seafood or eggs. You can even find it in some legumes like chickpeas, lentils, kidney beans, as well as you can also find it in some nuts and seeds as well. However, with the nuts and seeds, I know a lot of you might have some trouble chewing it. So if a nut butter is preferable, you can have some nut butter that you can add into a smoothie, and then it won't be too sticky. And then also protein can also be found in your dairy products or your milk and alternatives. And here I have listed some dairy products that are a little bit more higher in calories. So like whole milk or Greek yogurt, which has a little bit more protein than regular yogurt, and some cheese. And with cheese, you can just look at the milk fat percentage and choose ones that have a higher percentage of milk fat. So the main takeaway message here is just to make sure that you are including an adequate source of protein with every meal, and maybe even with your snacks as well. So sometimes I would also recommend my patients to take a nutritional supplement if they're not able to meet all their higher calorie needs. So here we have examples of a couple of nutritional supplements, and they're coming from both either the Ensure or Nestle company. So the two ones that you see on the first two ones, the nutritional supplements that you see, is ones that are really high in calories and high in protein. So this one is called Ensure Max, the first one right here. And then the next one is called Resource 2.0. And both of them are available in these standard sizes, which is about 237 milliliters, which is a little bit less than a cup. So these are the ones that are my usual go-tos. However, if you're not able to take a large quantity of it, there's also a shorter one that's available. It's right here called Ensure Compact. So it's a very small container, and it contains about 118 milliliters, so a little bit less than half a cup. So if you really want a more smaller volume, this one may be easier to take. And then the next one here is called Peptidin 1.5. And this one I only recommend to patients if they're experiencing any GI issues. So if they're having some diarrhea or indigestion, this one is the particles of it are a little bit more broken down, so it's easier for you to digest. And then finally, with the Boost pudding over here, this one is a pudding that's really enriched in some calories and some protein. And I would recommend this one if have patients that have difficulty taking in liquids. So if you have trouble with the liquids, maybe the pudding might be an easier option for you to get all the calories and protein that you need. So here are the two links to both the Ensure company and Nestle where you can find a lot of these products. Also, in terms of any alternative therapy, what the research has shown is that there really is not enough evidence to recommend any high doses of any vitamins, minerals, supplements, or nutraceuticals that can really help to decrease the progression of ALS. So really, if you are on any of these kind of things and you feel like it does benefit you in some way, then by all means, you can continue to take it. It is not a problem. However, if ever you feel like it is providing any harmful effects, or if you feel like the high costs of getting these kind of products is providing a financial burden to you, then in this case, maybe I would suggest to stop taking it because it is putting such a burden on you. But if not, if you are happy to take them and you feel like it's providing you some benefit, then by all means, you can continue to take them. So now I'm going to go through some of the issues that I mentioned before and how we can correct these with some nutritional interventions. So the first one is dysphagia, which I mentioned is the trouble and difficulty chewing and swallowing your food or your liquids. So with this, if you see in the diagram here, with the first diagram, you can see that food is supposed to, when you swallow, it's supposed to enter and go down the back of your throat into your esophagus. And so as you can see in the first picture here, it's going down your esophagus and should go into your stomach. Now, with dysphagia, because you have trouble chewing and swallowing, and because you have some weakened muscles, sometimes what happens is that your muscles are so weak that it doesn't protect the other path, which is the path to your airways and into your lungs. So because of that, particles of food or liquids can enter into the airways right here, and it can actually go into your lungs. And when this happens, this is what we call aspiration. And when this happens a lot, you're at risk of having aspiration pneumonia, which is an infection that occurs when these little bits of food or liquid or even bacteria from your saliva enters into the lungs. And when this happens, your lungs can become inflamed or really swollen, and it might be very hard for you to breathe, and you're going to need antibiotics to fix this. So this is what we want to prevent as much as possible. So when you have this trouble with chewing and swallowing, you want to make sure that you have a swallowing evaluation done. So swallowing evaluation can be done by a dietitian, it can be done by an occupational therapist, or a speech language pathologist. So it depends on which kind of ALS clinic you're being followed at, or if this is done at a CLSC, who is going to be in charge of it. It depends on each place. So during the swallowing evaluation, we're going to be testing how well you do with certain textures of food and different consistencies of liquid. And we're going to be able to give you a recommendation on what's the safest textures and consistency of liquids that you should be drinking. So we're going to give you the advice whether you need to make some modifications in these textures. And at the bottom of the link here, the screen here, I have a link for a website that you can go to so that you can understand more about what dysphagia is. And there is even some videos that you can see about what happens when you have dysphagia, and then gives you some tips and advice on how to treat it as well. So when somebody gives you an indication of what kind of texture your texture should be modified to, these are some of the examples that it can be modified to. So the first one here is the soft diet. So it's really making sure that all your vegetables, all your meats is very soft. So your meat should have a lot of sauce on it so that it's not too dry. The vegetables should be very soft, as well as any noodles or rice that you're having. The next texture that you can be modified to is a minced texture. So really think about minced meat, for example. Everything in minced meat is is minced well, and it's very small pieces. Vegetables should be cooked well and very soft, that it can be mashed up by a fork. And then finally, the last texture that you can modify it to, which is the most modification you can make, is a puree texture. So really everything should be passed through a blender so that it becomes pureed. So like mashed potatoes, your vegetables, everything should be passed through a blender so that it's pureed. And at the bottom here, I actually have a link to the ALS Nutritional Toolkit that was actually released by ALS Society of Quebec recently. And it's a very good toolkit with a lot of information. And I actually made a link to the pages that talk about modifying food textures if you want to know more about which foods that you're allowed to have with your diet and which ones you're not allowed to have. Also, here I have some examples of some liquids that are thickened. So when you're having a swallowation done, sometimes what we see is with regular liquids, it might be because it's a thin liquid, it can rush to the back of your throat very quickly. And with this, you can cough and you're at risk of having aspiration. So the best way to treat this is actually to thicken your liquid so it's much more easier to control and manage. So the first picture here on the left of the screen is a picture of a product called Thicken Up Clear, and this is a product that's provided by Nestle, and it's a powder actually that you can add to all your liquids in order to thicken it up. So this is a good way to really thicken your liquids. We also have some products called Hydra Plus, and this is the product that's made by Lachine, and the link to this company is at the bottom right over here. And these are products that have already been thickened. So you don't have to do any more thickening. It already comes thickened. So, and with this company, you can order some thickened water. They also have thickened juices available as well as thickened milk. So you really do have a variety of these liquids. And then here I have a chart about how to thicken your liquids if you do choose the powder option. So at the top here, you see that there's 3 different levels of thickness that might be recommended to you. So they might say to thicken your liquids to a mildly thick consistency. So that's kind of like nectar. It could be a moderately thick consistency. So think about honey, the consistency of honey, or it could be extremely thick, like the consistency of pudding. And with this chart, it kind of tells you, depending on the quantity of liquid that you want to thick, it tells you how much scoops or how much powder you should be putting in your liquids. And you should just, it's going to be very easy. You just have to mix it for about 30 seconds and let it sit before you take it. And you really use this powder for any kind of liquid, for your milk, tea, your coffee, your juices, even carbonated beverages. This powder can be used for that. So these are some strategies that I have listed here about some other things that you can do to help reduce the risk of aspirating. So the risk that food or liquids can go down the wrong way as much as possible. So the first thing we want is to make sure that you're having optimal oral hygiene. And what this is to really make sure that even though you are brushing your teeth, to make sure sometimes to brush your teeth or to clear your mouth even after a meal, because you can have some residue left over, or you can have some saliva, some bacteria in your saliva, and if after mealtime you might be at risk of aspirating on these little residues or bacteria in your mouth. So if you clean your mouth, then you're at lower risk of having aspiration pneumonia because of this. It's also very important that you're sitting up straight as much as possible, because if you ever tried lying down and eating, you know that it's going to be very hard to do. So when you eat, so when you sit up upright, when you eat, it's going to help foods go down the right way as much as possible. It's also good to cut up your food into little small pieces if you need to, and take small sips and small bites of your food as much as possible. Make sure that you're also swallowing the food in your mouth before you take another bite is also good as well. And to take your time and eat slowly, so we reduce the risk of aspirating as much as possible. Also, if you need to, adding a little bit extra sauce or gravies to your meal can really help smooth, it can really help with the swallowing. It's going to make it very smooth for it to go down. Now, if you have any troubles with taking your medication, sometimes if you mix it with applesauce, or you can put it in a yogurt and a pudding, and that will help you with the swallowing as well. And if you need to, you can also crush your medication. So just make sure that this is okay with your doctor, so that if you're not able to take the big pill forms, you can crush it, so it's much more easier to swallow. So as I mentioned before, dehydration is a big issue that we see in ALS, and there's many causes of it. The first one being dysphagia, so the trouble with swallowing your liquids. So in order to fix this, we really want to make sure that you're thickening your liquids and you're drinking enough of these thickened liquids so you're not dehydrated. Another thing is some people with ALS, they usually purposely avoid not drinking a lot because they don't want to go to the bathroom. And this is because we know that it takes a little bit more energy. You might need assistance to go to the bathroom. So they're trying to reduce having the need to go to the bathroom as much as possible. However, I would say that it's very important to stay hydrated as much as possible, because when you're dehydrated, it can lead to some negative side effects. And one of the things that we see most often is constipation. So when you're dehydrated, the stools in your bowels don't get enough water, so that it becomes very hard and it becomes very dry as well. And when this happens, it's going to be very hard for the stools to move along through your intestines, so you'll be constipated very easily. Another thing is that when you're dehydrated, your saliva can become very thick, and you might have secretions that form inside your mouth. And when they become very thick, it's going to be very hard to clear out. However, if you stay well hydrated, this incidence will happen very much less often. Also, when you're dehydrated, some signs that you may experience is that you're going to have a very dry mouth. You're going to have darker urine. You might be peeing a little bit less. And in really severe cases, you might feel very dizzy and have some confusion as well. So it's very important to stay well hydrated. And when we think about hydration, this is not just water that you need to drink, but also there's different types of fluids that you can drink that will keep you well hydrated. So things like juices, nectars, which is a little bit more thicker as well. So if you can't take regular liquids, the nectar, which is a little bit more thick, it might be easier for you to take. Some smoothies as well counts towards your fluid intake. Any soups that you have, preferably cream soups, because you are trying to increase calories as much as possible, as well as drinkable yogurt. All of these things can count towards your fluid intake. Also, there's some foods that you can have as well that have a little bit more water content as well, and that could also count towards hydrating yourself as well. So if, for example, things like applesauce, there's a lot of fruit purees, they have a little bit more water content, watermelon, all of these things have a little bit more water in them. So if you have decreased respiratory functions, so you're having some difficulty with breathing, this is going to make you be very short of breath while you eat. You're going to be very fatigued and exhausted during your meal. So you might not be able to finish your entire meal, or if you do, it's going to take you a very long time to do so, to the point that you're going to be exhausted by the end of the meal. So because of this decreased respiration, sometimes what we suggest is for you to go on some non-invasive ventilation, for example, like a BiPAP machine. And if you do have this kind of machine, what I suggest is, in order to give yourself the extra energy that you need to eat your meal, you can use your BiPAP machine right before you're having your meal. So it gives you that extra boost of energy so that you're able to finish your meal. Another trick that I say is that if it really is hard to finish your meal, then opt for more small, frequent meals. So have a small meal. You can wait about 3 hours and then have another small meal. So typically what we say, try to have at least 6 small meals a day instead of having 3 large meals, because you're exhausted after your meals. And then finally, just listen to your body. And if you feel like there's a point in time where you're not so tired, you're not so fatigued, and you're able to eat more, then really do so that you're getting all the calories that you possibly can. So if you have some difficulty to feed yourself, so really the mechanics of just getting food from the plate into your mouth, if that's very difficult, and I know that it's going to use a lot of your energy during your meal time. So kind of like what I mentioned before, in order to make sure that you're getting as much energy as possible, to maybe make sure that you're well rested, and or if you need to take a nap before a meal, so that you have as much energy as possible during the meal time. Also, you can also use some adapted equipment. So this is equipment that's going to help you eat, use some utensils, or drink liquids. And I'm going to be talking a little bit more of some examples of adapted equipment that you can use. And then finally, if this doesn't work, then really, I'm sure that everybody has a great support network. So try to find somebody within your family, loved ones, that can maybe help you to help feed you. And for any caregivers out there, I just want to let you know that, and if you are helping to feed someone with ALS, make sure that you're at eye level with them when you're feeding, because when you do feed them, you want to make sure that they don't need to strain their neck to reach the spoon. So that might be difficult. So really make sure that the spoon and that you are at eye level, so it makes the process of feeding much more easier. So these are some examples of the adapted equipment that I was talking to you about. So the first one here is a partition scoop plate. So the scooper plates, like the first one and the blue one right at the bottom of the screen, these are plates that have a little bit of a thickened rim. So the rim is turned up so that when you're eating, food doesn't spill out, but at the same time you can use that rim and scoop up food into your spoon if you need to. So these are some great tools to use. And the scooper plate at the bottom, this one actually comes with a suction-based cup so that it keeps the plate on the table and it doesn't move around. So that could be really good to use. And then here we have some examples of some cups that you can use to drink. So the first one here is an adult sippy cup. And what I like about this one is that if you have weakened muscles and you need both hands in order to pick up a cup to drink, you can use this one because it has two handles. You can pick it up much more easily to drink. And because it's a sippy cup, it's going to really give you small sips of liquids at a time, so that if you do have trouble with swallowing liquids, it will give you very small amounts so that you can decrease the risk of it going down the wrong way. Now, the cups at the bottom here are called the dual cup. This one is a cup that it kind of cuts out a small piece of the cup where you can actually put your nose in. So when you're drinking, usually if you drink and you want to get to the stuff at the bottom of the cup, you usually have to tilt your head back in order to do so, because your nose is in the way. That prevents you from tilting the cup, so you're tilting yourself back up to get to the stuff at the bottom. But with these cups, because it cuts out a part of the cup, you can actually just tilt the cup and get all the stuff at the bottom of the cup instead. So this is it's a very cool cup to use, and you can actually easily do this with a styrofoam cup as well. You can kind of cut out a part of it and do it yourself if you want to. Now this cup right here, this is called the sip tip cup. And what's great about this is that for some of you, if you have a little bit more difficulty breathing and it requires you to use up a lot of force to get the fluid up into the straw, this is another option that you can use. So with this cup, what you see is that when you do suck up the liquid up the straw and you take your sip of liquid, what happens is that instead of the liquid falling back down inside the cup, it's going to stay near the tip of the straw, so that you only have to use a minimal amount of force to get the rest of the liquid up inside your mouth. And then the last one here is called the profile cup. And then with this one, what's great about this is that when you tilt the cup up, it actually has a predetermined small amount of liquid that stays within the lid. And so that when you drink, you're only getting small sips of liquids at a time. So it's really good to control how much liquid you're getting in, so that you don't get a big rush of liquid coming into your mouth and you might cough on it. So these are some great adapted equipment that you can use if you have difficulty with eating. So now, if you have difficulty with meal preparation, I have some tricks here that you can use. So because you might have less energy, you have weakened muscles, it might be hard for you to actually cook and prep your food. So if this is the case, sometimes, you can listen to your body, and if there's a time when you're not feeling so tired, maybe start prepping your food then. So you can cut up some vegetables, make the sauce for your foods, so that when it does come time to cook your meal and then eat it, you're not so tired while you're eating your food, because you already did a lot of the prep work beforehand. There's also some great meal services that are very popular called Good Food or Hello Fresh. And these are some meal services that can send you recipes, and they'll already have all the food prepped for you. So that this way, all you have to do is put the ingredients in a pot or in a pan and cook it. Also, however, if you do need to cook, sometimes I suggest to cook in large batches. That way, you can reduce the amount of time that you're cooking, because any leftovers that you have, you can just put it into the fridge or into the freezer to have for a later time. And then finally, do not be afraid to ask for help if you don't have the energy or the strength to cook your meals. Ask somebody from your support group, or let your medical profession team know, and they can help you out with that. And then finally, there is also some services that provide ready-made meals, already cooked, already prepared, and it'll be delivered right to your door. So one of these services is called Meals on Wheels, and it's a program available all in Quebec. And you just have to register to this program, or you can have your dietitian, your social worker register you to this program. And with this, they're going to give you prepared meals straight to your door. There's also some companies that provide you with pureed food. So if you had your swallowing evaluation done and you know that you have to be on a pureed food consistency, then you can refer to some of these companies which will provide the pureed food for you. So Epicura is actually one that I like. There's a picture at the bottom of the screen right here. And what I like about it is that the pure food becomes molded into the food that you're actually eating. So for example, let's say if you're eating some carrots, instead of it just being a blob of orange food, they're actually going to mold the puree to the form of a carrot so you know what you're eating, and it also makes the food more appetizing to eat. So that's a really good option. However, this is not the case if you don't mind how your food looks like. You also have the option of Campbell Très Purée, and this also provides you with some options of pureed food. And I have the links to each of these places at the bottom of the screen so that you can refer to it. Finally, one thing that I mentioned was that you can, with ALS, you can have changes in your saliva. So sometimes you have an accumulation of saliva in your mouth. And this can be because due to the fact that you have a decreased ability to swallow your saliva. So a lot of the times, if you're not actively swallowing your saliva, you have an accumulation in your mouth, and this can lead to some drooling and some difficulties managing all of the saliva. And in addition, hydrate and cause secretions in your mouth to become very dry and very uncomfortable. Usually, in order to help with this, there's many different things that you can do. So sometimes if you have an oral suction machine at home, you can suction all of this extra saliva and secretions out of your mouth. Sometimes the doctor will give you some medicine to help with this. However, what I like to tell my patients is make sure that you are staying well hydrated so the saliva and the secretions don't become so thick and dry. And also because when you do drink liquids, what happens is the fluid actually helps wash the extra secretions down into your throat and into your stomach so that you're clearing it away from your mouth as much as possible. Also, it's important that whenever you can, just to remember to actively swallow regularly so that the saliva doesn't accumulate in your mouth as much as possible. So in terms of gastrointestinal intolerances, there's really many that can happen. However, the one that I see the most often is constipation. And the reason for that is that in ALS, typically what we see is that you have decreased gut motility. And what this means is that the amount of time that it takes for your food to go down the intestines is much slower than normal. And this can be because of many different reasons, but one reason could be because of decreased physical activity. So if you're not moving around as much, the food is not going to go down your intestines as quickly. So because of that, you are much more likely to be constipated. Another reason why can also be because if you're not having enough fluid intake. So as I mentioned before, when you're not drinking enough fluids, your stools can become very dry and hard so that it's hard to go to the bathroom. And a lot of my patients say, well, I'm eating a lot of fiber, and even though I'm getting fiber in, I'm still not having any bowel movements. Well, the thing with fiber is that if you're just having fiber, it's going to stay in your stools, and it's not going to do anything unless you have the fluid intake to go with the fiber. Because when the fluids mix with the fiber, what happens is that it forms this gelatinous soft stool, which will make it easier for you to go to the bathroom. So it's very important that you are having a high fluid intake. So try to drink at least 1.5 to 2 liters of liquid per day so that you're getting enough fluid, and that if this doesn't help, then also having more fiber in your diet. So choosing a lot of whole grains like brown bread, whole wheat pasta, these kind of things, as well as having some fruits and vegetables in your diet as well. And then finally, if you tried all this and it doesn't work, then you can also resort to some medication. So things like a stool softener, like Colace is a good one that's going to help soften your stools, or a laxative is a little bit more stronger. So some called Laxaday or Restoralax, these are ones that can really help with constipation and help you go to the bathroom. So some other GI issues that we see is bloating or having gas is a big one. And this can also be related to your constipation. So when you're constipated, you're having more gas being produced and you're bloated. So that's not good. So sometimes when you relieve the constipation, you see that the bloating and gas resolves itself as well. Another one that we see is nausea and reflux, and this can happen sometimes in patients that have delayed gastric emptying. So what this means is that the contents in your stomach, it's very slow for it to empty out into the intestines. And when this happens, sometimes if you're eating a lot of food, it's just going to stay in your stomach and it's not going to move into your intestines very quickly. So it causes you to be nauseous or for the food to come back up and have some reflux. So if you do have this, sometimes having small frequent meals is better. So you're having small quantities, gives you time for your stomach to empty it out into your intestine. And then you wait your 3 hours and have another small meal, and doing this about 6 times a day. So this can really help with that. And then finally, we have diarrhea. So diarrhea doesn't typically happen in people with ALS unless they have really high intolerances to a certain food, or it's more common in tube feeding. So depending on the formula that's being given by the tube through the tube, you may have some diarrhea with it, in which case you may need to change the type of formula that you're on. So then finally, we're going to go through tube feeding, and I'm going to be talking to you about what tube feeding is and why we might use it for patients with ALS. So with tube feeding, one of the times that we recommend tube feeding is when you're not able to get all the calories and all the nutrients that you need by the mouth. And if you're not getting that, you're going to be losing a lot of weight and it's not going to be good. So instead, we say maybe we can feed you through that. So this is the feeding tube that we can put into your stomach. So this one can be inserted. It's going to be inserted through your skin and into your stomach. So this is the outer part in the picture right here. This is the outer part of the feeding tube, and this is the part that's going to go into your stomach, as you can see right over here. And then at the end of this tube, they have a balloon that's going to be inflated with some water so that it prevents the tube from falling out. So typically with this feeding tube, the main port right here is where you're going to be given your liquid food, or what we say, your formula. So it's going to be entering through this tube so that it goes into your stomach. And then they have a cap at the end of the tube so that you can close the tube when you're not using it. And they also have a little extra port for if you want to put your medications through. So there's usually 2 types of tubes, feeding tubes that you can get. So it could be a PEG, which is usually inserted by a gastroenterologist, or a RIG, which it can be inserted by a radiologist with the help of some x-rays. So each one just still provides you with the same end goal, which is this feeding tube in your stomach. The only difference is how the procedure is really done. So either way, with both cases, the procedure shouldn't take more than 1 to 2 hours to insert into your stomach. And depending on the institution where you're getting this procedure done, sometimes you're admitted into the hospital for a day, you get the procedure done, and you'll be discharged by the end of the day. In some institutions, like at the Montreal Neurological Hospital, which is where I work, we like to make sure that once you have the procedure done, we're going to be keeping you overnight, and so that the next day we can start using this feeding tube. So we're going to be able to give you the formula to see if you're tolerating it through the feeding tube. So with each institution, it depends, but at the end, you're always going to have a dietitian there to give you all the information of how much formula you might need and to make sure that it's well tolerated. And as well, when you're discharged from the hospital, you're going to have a CLC dietitian refer to you. Oh, sorry, one moment, please. My lights went out. Okay, it's back. We're good to go. So you'll have a CLC dietitian refer to you so that they can follow up with you and see if you're tolerating the tube feeding well, and they can adjust how much formula you need. And at the bottom of the screen here, I have a link for a website which gives you a little bit inside information on how it is living with living with the tube feed, and it also shows some videos of how to use the feeding tube. So one way where, so these are some indications that I have listed on when a tube feeding might be recommended to you. So the main reason that we might recommend a feeding tube to you is when the amount of food that you're eating is not enough to meet all the nutritional needs that you need. And we see a lot of weight loss because of this. So we want to make sure that you're not losing any more weight. So we might recommend giving you the feeding tube so that you're getting all the calories that you need through this tube. We can also recommend it if you have severe dysphagia, so a lot of difficulty with chewing and swallowing the food, and that sometimes it might not be safe at anymore to even eat orally. So in this case, a feeding tube might be recommended to you. It's important to note, though, that even though you do have a feeding tube, you can still eat by mouth if you want to. So a lot of my patients, they tell me, oh, but I still want to have my sweets or dessert, or I still want to eat one meal a day just for quality of life, and that is no problem. So if you don't have too much difficulty with it, you can still eat by mouth if you want to. And then with the feeding tube, it's just going to give you the rest of the calories and protein that you need to make sure that your weight is stable. Another reason why we might recommend a feeding tube is if your respiratory function or your respiratory function declines. So if you're having really a lot of trouble breathing, this might be an indication to have a feeding tube. And the reason why is that usually if you're being followed at an ALS clinic, you're going to have a pulmonary function test done. And what this does is it measures your capacity to breathe. And one of the things that we look at is the FVC, which is your forced vital capacity. And this is just an indicator to tell us how well you're breathing. And if we see that it's declining a lot and that it's slowly starting to approach 50, we would recommend having a feeding tube put in. And this is because once the FVC is below 50, having this procedure done is a little bit more riskier because of your decreased respiratory status. It doesn't mean that you cannot have the procedure done. It's just that it might be a little bit more difficult to do and it might have a higher toll on your breathing during the procedure. So because of that, we want to make sure that you get the feeding tube done when you're an ideal candidate. So when your FVC is higher than 50%. So really, if you're interested in getting a feeding tube in, or if you think that this might be an option for you, just make sure you talk to your dietitian and see if you have a need for a feeding tube or not. So some of the benefits of getting a feeding tube are that with the feeding tube, it's more easier to meet all your nutritional needs. So meeting your calorie needs, meeting your protein needs, because in the formula that we have, so it's going to be a liquid formula that's going to come in a bag, and it's going to be, you can hang it on an IV pole, and basically it's a bag that's going to have all the nutrients that you need, the vitamins, the minerals, and from that bag, it's going to slowly drip. It's going to connect. There's going to be a tube that connects to your feeding tube, and it's going to slowly drip inside your feeding tube. So with that, it's going to have all the nutrients that you need. So it's going to be easier to meet your nutritional requirements. And with that, because you're meeting all your nutritional requirements, your weight is going to be able to be stabilized. So that's a really good benefit of the feeding tube. It's also going to prevent dehydration because you're getting all the liquids you need with the formula. And it also is shown to have lead to increased survival time because your weight is stable and you're meeting all your nutritional needs. And finally, it's going to give you the opportunity to conserve your energy. And because of this, because usually with eating, it's a little bit more troublesome if you especially have difficulty eating to get all the calories that you need. But with this, you just kind of plug the tube into your stomach and you just sit back and relax and have all the feeding tube do all the work. So it's important to note that with the feeding tube, it's okay if you want it, but it's also okay if you don't want it. Not everybody wants to have a feeding tube in. So it's important that if you don't want it, before you make that decision, just make sure that you do have all the information that you need in order to make an informed decision. So talk to your doctor, talk to your dietitian, and get all the information that you need. And then with that information, talk to your support group, your family, loved ones, and and then with all the information, you can make an informed decision. So if you decide at the end that tube feeding is interesting and that you would want this option, then that's perfect. You let your healthcare professional know, and we will get the tube feeding in. However, if this is something that you don't want, that's okay too. It is your decision at the end. However, if you have decided that you want to get the tube feeding in, usually we want it to be inserted within a maximum delay of 4 weeks since the decision has been made. And the reason for that is because we want to make sure that your nutritional status is not declining even more from when you first decide that you need a feeding tube in. And then finally, when it comes to the peg and the rig, which is the two different types of procedures for getting the feeding tube in, the ALS guidelines show that there is actually no sufficient evidence to recommend one or over the other. So both of them are very simple procedures. However, at the Montreal Neuro, where I work, we typically do the rig more often just because usually it takes a little bit less time to put in using this method, and also because it requires a little bit less sedation. So that way it doesn't impact your breathing so much during the procedure. So these are some different methods for which the tube, your formula can go into the feeding tube. So the first method right here is through via syringe. So what you do is with the formula that you're given, you just suck it up with the syringe and then you push it in through the feeding tube as shown here. And as I mentioned before, your dietitian will let you know what volume of formula you need to meet all your nutritional needs. Another option is through gravity. So what this is this what we call this is a gravity bag. So you're gonna have an empty bag and you're gonna have your formula. So your formula is what you're gonna pour into this gravity bag. And this bag is then gonna be attached to an IV pole. So it's gonna be hanging on your IV pole, and then you have a tube that connects from the bag, and it's going to drip down into your stomach and it's going to connect into your feeding tube. So that way you just let the force of gravity let the liquids to slowly pour down the tube and into your stomach. And you even have a clamp on the tube where you can adjust how quickly the volume goes down. So you can make it go really fast into your feeding tube, or you can slow it down as well. And then finally, we have the option of the pump, where it's similar to the gravity bag, where you're gonna hang your formula onto the IV pole, but instead you have a pump that you can program to say how much liquid in an hour do you want the formula to enter into your stomach. So you can really program the rate at which the fluid is going to go into your liquid. So sometimes you just program it, you press start, and it's going to pump the liquid down into your stomach by itself. So which method you choose really depends. So the dietitian will speak to you about each method and they can decide which one is best for you. And then finally, these are some examples of the formulas that you can get. So these are pre-prepared, and you can buy them off, you can get them from the Nestle company. However, here in Quebec, usually the formula is actually covered with RAMQ. If you have RAMQ, it's going to be covered with that, or sometimes if you have a private insurance, we can see if it's covered with that. So what you have here is the bag that I was talking about. And this is the one that you're gonna hook onto the IV pole, and it contains all the liquid, all the formula that you need. So what the guidelines tell us is that when you're choosing a formula, you want to make sure that it's a high calorie dense formula. So typically what we want is that each milliliter of formula provides 1.5 to 2 calories. So really one that's more calorie dense. And the reason for this is because if it has more calories per volume, you're going to be able to you only need a smaller amount of volume to get all the calories that you need. And it's going to decrease the amount of times you need to be fed with the tube. So these are some examples that I have of formulas. And the first one here called isosource 1.5 fiber. This is the one that I typically use. So it has 1.5 calories per milliliter, and it also contains some fiber in it. And this is very helpful for patients that are experiencing constipation. The fiber with enough fluids will help with that. So this is my go-to one that I give to everybody. Another one that I give sometimes is if a patient is experiencing some diarrhea, or if they're experiencing some bloating or nausea, then this formula might be more easier to digest. So this would be an option that I would go to. Finally, the last one here, this one's called Complete. And it does not provide 1.5 calories per milliliter. It provides about 1.06 calories per milliliter. However, some patients, they don't want a standard commercial formula. They want something that's made with real food. So this is a good option. It's a mixture of pureed foods, and that's been liquefied and to fit into the bag. And this is a good option if really you're looking for real foods. The Complete is a formula like this. There's also an organic version available as well. However, the organic version is not covered with RAMQ. So if you want this version, it's going to have to be coming out of your pocket. So as I mentioned, I put the link of the website where you can look at all these products, look at what the nutritional value is, and see which one interests you. So that is the end of my presentation. And I guess now if anybody has any questions, I can answer that.
Thank you very much, Madura. That was wonderful. Do you mind to stop sharing your screen so we can see the participants?
No problem.
Merci beaucoup. Lee, est-ce que vous avez des questions sur le chat?
Il y a une question. There's one question. Can thickeners be used for alcoholic beverages? Est-ce que les épaississeurs peuvent être utilisés pour des breuvages alcooliques?
Yeah, so with the thickeners, it can also be used with alcohol beverages. It's just that sometimes if, let's say with beer, where they have a little bit more bubbles in it, it's a little bit harder. So you would have to kind of let the bubbles settle a little bit more so that the thickener can really be used with these beverages. But usually, yes, you can.
I have no question. Oh.
Pardon? Yes, Lee?
Go ahead.
OK. Si les questions, merci. Madame Boucher, si vous avez des questions, faire comme Madame Boucher et dans l'icône qui est réaction, vous pouvez lever la main. Oui, Madame Boucher.
Bonjour. Hi. Is it still safe to go to the dentist when we have dysphagia? Est-ce que c'est encore sécuritaire de faire un nettoyage des dents quand on a de la dysphagie?
Yeah, so it is safe to go to the dentist. However, some dentists might not know that you have dysphagia or that you have some trouble swallowing. So really just make sure that your dentist knows so they can adapt to the cleaning based on that. And it is important that you regularly get your mouth cleaned, because you want to make sure you do have optimal oral hygiene, as I mentioned, because if you're having a lot of the bacteria and secretions in your mouth, you want to make sure that it's cleaned regularly so that you don't have that risk of aspirating. But yes, just make sure that your dentist does know so that he can make adjustments as needed.
Thank you.
I believe there's another question in the chat, Lee. Yes?
So there's Madame Loyer who mentions that Compléa 1.5 est maintenant disponible et remboursé par le RAMQ également. So maybe a new development that there's a 1.5 version of Complete that is now available and reimbursed by RAMQ. So merci Madame Loyer pour ça. Thank you for that. The other question is, what about glutamate? I'm not quite sure what the question's referring to. Maybe Madura, you'd know.
I'm guessing, I'm assuming that if they take any supplements containing glutamate, I think that was maybe the question, anything like that. And really what the research has shown is that, especially in any human studies, there has been no evidence that these kind of supplements should cause will help decrease the progression of ALS.
Okay, sorry, she clarifies, should I avoid food containing glutamate? Thank you, Romina. Est-ce qu'on devrait éviter?
No, so really just making sure there's no research that says that it's going to affect anything. So really just making sure that you're eating a well-balanced diet with high calories is enough. You don't need to be avoiding any kind of foods like that.
Thank you.
Oui, Monsieur Benoit, si vous aimeriez.
I have a question. We talked about vitamins, minerals, and nutraceutic. I don't know what it is. Nutraceutic.
Yeah, so nutraceutics are basically like the little supplements, like let's say, for example, if you're taking any extra, it's basically any supplements of food a little bit that that you can take. So let's say, for example, any like antioxidants, or they say that phytochemicals, anything like that is associated with food, like if you have higher amounts of that, if that's going to help with the ALS, and it does not. So I don't know if that was very clear.
All right. Thanks.
No problem.
Est-ce qu'il y a encore des questions pour Madura? Merci, Lee.
On a une autre question dans le chat. Another question in the chat. How does alcohol affect ALS? Comment est-ce que l'alcool pourrait avoir un impact sur la SLA? Je sais.
So with alcohol, what we say is, so there's a certain amount that's allowed for males and females, so it's a little bit different. So women, they're allowed to have about 1 drink per day, whereas men can have 2 to 3 drinks per day. So that's the standard recommendation for everybody. There's nothing that says that having that standard amount is going to impact you for ALS. So there's nothing that says that you can't have that standard amount. For sure, if you're having more than that, that's gonna affect your nutritional status. Mainly, it's gonna deplete your resources of something called thiamine, which is a mineral that everybody needs. So if you're having more than that, then you might want to just let your doctor or dietitian know so that you can get supplements for this thiamine. But in terms of anything else, like specifically for ALS, as long as you're meeting these, if you're not going above these amounts, then it's not going to affect you.
Merci. There's another question. Est-ce que le gain de poids est bon ou non? Is it a good idea to gain weight or not?
Yeah, so with ALS, with the high calorie diet, especially if you're underweight, if the goal is really to make sure that your weight is stable. However, if you can even gain some weight, that would be great as well. So if you're underweight, then we say, if possible, try to gain your weight so that your BMI is within that 25 to 35 range. And once you meet that range, then the goal is to make sure that your weight is stable. Sometimes I know that if you're at the higher end of the range, let's say you're at a BMI of 35, we just want to make sure that it's stable. If it's more than that, sometimes it might be a little bit difficult with mobility. Like you might feel like it's a little bit harder to move, but typically patients don't, if you're already at that stage, you're not going to be able to gain any more weight. So really trying to get to that nice range between 25 to 35 is good.
Do we have, est-ce qu'il y a des autres questions? Quelqu'un veut lever la main par la réaction pour une question? Sinon, donc, Lee, est-ce que vous pouvez partager l'écran que Madame Tekelec peut parler un petit peu de notre trousse de nutrition?
Est-ce que vous voyez l'écran?
Oui, merci beaucoup.
Merci.
Diane.
Merci, Kate. Thank you, Kate and Lee. Bonjour à tous, and merci beaucoup, Madura. Thank you very much for sharing your expertise with the community today. We're very happy to have you speaking to us as a part of Nutrition Month here in Quebec, and are very thankful to not only yourself, but all of the dietitians and nutritionists that help the community across the province. Very excitingly, on a lancé des trousses nutritionnelles pour la SLA la semaine dernière. The toolkits are available in both English and in French, and are available on the website sur la plateforme Prendre Soin, or the Taking Care resource platform on the website. What's good to know is that on the resource platform, you can find these no matter whether you are a person diagnosed with ALS and living with ALS, whether you're a caregiver or someone who is a friend that is helping someone who is living with ALS, or whether you're a healthcare professional and just looking to expand some of the comprehensive information with regard to nutrition and ALS, and maintain yourself up to date. It's truly exciting to be able to provide you with some of this information. La trousse amène plusieurs aspects, des astuces, des conseils pour gérer le quotidien avec la maladie. Et ça souligne quand même les informations qui étaient démontrées par Madura aujourd'hui, et parfois rendre en profondeur avec d'autres entités. So you might find also some more in-depth information which complements what Madura has talked to you today. It's quite a comprehensive guide, so it's recommended that you visit the elements of it that are pertinent to you at the time that those elements are pertinent to you, whether it be how do I equip my kitchen, or I'm really looking to change up what I'm eating because I'm getting bored of eating the same thing all the time, to better understanding what options you have in nutrition, et aussi des autres ressources communautaires que parfois nous aident dans notre quotidien, soit où trouver des produits spécialisés pour la dysphagie, ou bien des repas adaptés à des textures modifiées, ou trouver des épaississantes alimentaires, finding thickeners and how to use them. It's really meant to be a resource for families to consult and help them in their everyday, help them maintain that nutrition, which is so important in ALS, and keeping you as well as possible as you continue your journey through ALS. So I hope that aside from the information that you were provided today, that you take a moment. The toolkits are available, sont disponibles pour être téléchargés immédiatement pour votre for your review. Et à part de ça, sur le site web et également dans les infolettres qu'on vous envoie à travers les communications de la société, vous pourriez toujours rester à affût de tout ce qui est en offre, soit des groupes de soutien, either support groups, des conférences, interesting conferences, such as ones that are being provided to you today, or also anything in terms of the activities and what is on offer in terms of support to the community in the Bulletin Info Express, which is provided to you on a regular basis. At last, Lee, if you can just push the slide up so that people can see the bottom of it, because I'm not sure it's being cut off in the view of people, but essentially vous êtes la bienvenue. You're welcome to contact the society at the time that suits you, whether it be on the website, by telephone, or by email. There's a very, very dedicated team that is willing to support you with any questions and information that you may have. Alors voilà, there it is, the website as well as the telephone and toll-free information. We hope that you provide us with a bit of feedback if there are, si vous voyez qu'il y a des ressources dans votre communauté qui ne sont pas incluses dans la trousse, vous êtes la bienvenue de nous envoyer votre suggestion et on va adapter les informations à fur et à mesure qu'on a des informations supplémentaires. Merci beaucoup à tous. And Kate, Lee, that's all I have to say.
Merci beaucoup, Diane. Je juste veux rappeler le monde que cette conférence est enregistrée. Donc, dans les prochains jours ou semaines ou quelque chose comme ça, la conférence serait sur notre site web. Donc, vous pouvez consulter la conférence à votre aise plus tard. S'il y a des autres, est-ce qu'avant que nous terminions cette conférence, je souhaiterais que personne n'a pas encore une autre question, un autre commentaire à partager? Ah, Lee, yes.
J'ai un commentaire de Mme Loyer. Oh, pardon. J'ai un commentaire de Mme Loyer encore qui dit, pour faire du pouce sur ce que Diane disait, je suis nutritionniste en soins à domicile et je souhaite vous féliciter pour ce superbe document. Il est très complet, très bien fait, très utile autant pour les patients et leurs aidants que pour les professionnels. Il me sera très utile. Bravo pour ce beau travail. Merci, Mme Loyer. C'est
génial d'entendre ça. Donc, je ne veux pas garder le monde inutilement. Donc, c'est l'heure de lunch et comme Madura a dit, c'est très bien d'assurer que nous sommes bien, nous mangeons bien et que nous sommes bien hydratés. Donc, je invite tout le monde de faire leur dîner maintenant et d'appliquer les points que Madura avait donnés nous aujourd'hui. Donc, merci beaucoup pour votre participation et nous aurions des conférences le mois prochain. Donc, gardez l'œil sur nos communications, comme Diane a dit. Donc, je vous souhaite tout le monde un après-midi ensoleillé. Bonne journée. Merci.